Hi, good afternoon. My name is Dr M Narendran. I'm the resident consultant ophthalmologist and retinal surgeon here at Bukit Tinggi Medical Center. I've been with this institution for the last 7 years and it's been a wonderful experience working with this institution. When you talk about common eye diseases, I would like to split it between pediatric, that is the children, and the adults. Among the children, I think prevalent post-COVID, I feel refractive errors. That means the need for glasses. Patients can be short-sighted, can be long-sighted, or they can have rabun silau, what we call as astigmatism. And of course, another issue is because of all these fast foods and processed foods, a lot of children also end up having allergic eye disease, and also because of the dust. So that's another thing among children. And for adults, I think the most common is cataract, and then glaucoma, and of course retinal problems because of diabetes and hypertension. When we talk about children, I think prolonged use of digital media, iPads, handphones, and long hours at TV, sitting very close to the TV, can aggravate the refractive errors that they could be developing and is undiagnosed. The other risk factor is playing in a very dusty environment, whereby they can get allergic to dust and all that. For adults, risk factors is aging. So all the problems like cataract, glaucoma, most of the time starts at 40. So we always say have an annual eye assessment done at that time. You have the complications of diabetes and hypertension also affecting the nerve, that is the retina in the eye, which can lead to blindness. Too much of screen time can affect both the children and the adults. There is a condition called as computer vision syndrome, whereby we tend to look at our PCs, laptops, and our handphones for long hours. Normally we tend to blink about 20 to 22 times a minute, but if you notice, when we do this gadget usage, we tend to forget to blink because we're staring at the media that is there. So you end up with dry eyes, eye strain, headache, and of course for children you can have a progression of the refractive errors. Follow the rule of 20 for adults. That means for 20 minutes you work, you relax for 20 seconds by looking at a distance of 20 feet. And for those who develop dry eyes because you're also working in an air-conditioned environment, I would advise you to use lubricate eye drops. And if the symptoms persist, I would advise you to get an assessment with an ophthalmologist nearest to you. Here I will say divide again into children and adults. For the children, I would ask the parents to notice whether the child is having any difficulty for looking at distance, focusing in school. Please find out from the teachers whether the child is able to concentrate in class, able to write down without making any mistakes or prolong, because sometimes when there is poor vision, there is nothing there to help the child focus on the studies. And if you do need to take your child to an optical shop, I would advise you do it in the morning rather than doing it in the later part of the day when the child can be tired with the normal activities. For adults, once you're touching the age of 40 and you're having difficulty, I think you need to go and get yourself assessed to see whether you need glasses for reading. If you have problems of night driving or distance vision blurring, get yourself assessed. You could be having cataract, it could be glaucoma, or it could be any other retinal pathology that could be present. So what I would say is after the age of 40, get an annual eye assessment done.